Welcome back to our channel. Today we are diving into an exciting development in the world of acid-related disorders, Vonoprazan. It's new kind of medication that could change the way we treat conditions like GERD and ulcers. Let's explore what makes Vonoprazan stand out and how it compares to other medication we already know. First, a bit of history. Vonoprazan was developed by Takeda Pharmaceuticals and initially launched in Japan in 2015. Since then, it's been making its way around the world. It's now approved in multiple regions, including South Korea, China, and recently even in US and Europe. This rapid expansion shows just how promising Vonoprazan is in treating acid-related issues. And even in India, it enters in 2023, started with Sun Pharma, then Dr. Reddy's, Lupin, Alkem, Zydus. Talking about gastric acid secretion and hydrogen potassium ATPase pump, parietal cells are there in our stomach lining, and there is a hydrogen potassium ATPase pump. What hydrogen potassium ATPase pump do? It transport hydrogen ions into stomach lumen. Then this will create a highly acidic environment essential for the digestion and protection of the pathogens. These are there from ages to control the gastric acid secretion. So what it do? It simply block the hydrogen potassium ATPase enzyme, and this is done irreversibly, and it inhibits the proton pump, and overall acid production is stopped. The major limitation with PPIs are it has a variable efficacy and may be subject to individual differences and even the differences in the metabolism and responses. Vonoprazan is a paradigm shift in acid suppression. It's a novel potassium competitive acid blocker, and it represents a significant advancement in the treatment of acid-related disorder. Its unique mechanism of action and pharmacological profile sets it apart from the traditional proton pump inhibitors like pantoprazole. Vonoprazan. It belongs to the class called potassium competitive acid blockers, or PCABs for short. This is different from the familiar proton pump inhibitors, or PPIs, like pantoprazole. Vonoprazan blocks the hydrogen potassium ATPase pump, also known as proton pump, in stomach cells. By doing this, it reduces the acid production almost immediately after you take it. No delays. Unlike PPIs, which can take time to activate, Vonoprazan gets right to the work, providing a faster relief. And if we look at into how Vonoprazan stack up against traditional PPIs, so PPIs also target acid production, but in a different way. They come with some limitation. For instance, PPIs requires a low pH to activate, which can mean delayed onset and inconsistent relief. Vonoprazan doesn't need this activation time, offering a faster and longer lasting acid suppression. Plus, it's stable in both acidic and non-acidic environment, making it more reliable for a wider range of patients. Now, regarding the therapeutic application of vonoprazan, it is used in gastroesophageal reflux. In short, we also call it GERD, peptic ulcers, H. pylori eradications, and erosive esophagitis. What does the research say? Clinical trials show that vonoprazan provide faster and more sustained acid suppression than PPIs. In treating GERD, for example, it's shown higher healing rates and a better symptom control. For H. pylori infections, vonoprazan-based regimen have been even more effective at eradication compared to the traditional triple therapy with PPIs. This makes it a potential better choice for a patient needing a quick and consistent relief. Now, the safety and tolerability, if we talk about, it is safe for a cardiovascular safety is there. Neurological effects like headache or dizziness is generally low with vonoprazan. Unlike long-term PPI use, vonoprazan does not appear to increase the risk of osteoporosis or fracture. Vonoprazan is generally well tolerated with a low incidence of adverse effect on the gastrointestinal system. So overall, the vonoprazan is a safe and a tolerable drug. Now let's talk about how vonoprazan works in the body. Once taken, it reaches peak concentration within just a few hours. The typical dose are 10 mg and 20 mg, depending on the severity of the condition. Because of its stable absorption and long-lasting effect, most patients only need to take it once a day, which is convenient and could lead to a better adherence. And as such, indications is concerned, erosive esophagitis, healing 20 mg orally once daily for 8 weeks, and in the maintenance 10 mg orally once daily for up to 6 months. Heartburn 10 mg orally once daily for 4 weeks. H. pylori infection, if it is in a dual therapy, then 20 mg orally twice daily with amoxicillin for 14 days. And if it is in a triple therapy, then 20 mg orally twice daily with amoxicillin and clarithromycin for 14 days. Vonoprazan was first marketed by Takeda with the brand name of Take Cab, and now lot of companies are releasing generic version as the drug gains popularity. In India, you can see Ares, Macleod, Mankind, Alembic, Larenon, Cipla, Sun, Hetero, Abbott. These all companies have launched this brand. And if we talk about the pricing, it's a bit expensive than PPI, but due to its advanced formulation, and this may affect the accessibility in a certain region, but prices vary widely across the market. So what next for the vonoprazan? Experts believe it could soon become a go-to treatment for acid-related conditions as PPI resistance group. Research is also underway to explore vonoprazan's benefit in more complex acid disorders like Barrett's esophagus. As awareness and access increases, we may see vonoprazan reshape the landscape of patients who struggle with acid suppression. So to wrap up the things up, vonoprazan is indeed a breakthrough in acid suppression therapy, offering rapid and consistent relief with its unique mechanism and high efficacy. It provides a powerful alternative to PPIs, especially for the patient who haven't found success with standard options. Thank you for watching. If you found the video helpful, don't forget to like, subscribe and hit the bell for more insights into the latest medical advancement. See you in the next video.